Hi there, this is Anna Dolopo, and today I'm going to talk again about Qigong, and I'll be doing Qigong tomorrow at 9 a.m. at the beach, December 13. If you would like information of where I will be, go ahead and text me at 619-341-4341. This is imperative for all of my patients to watch, and especially if you're working on strengthening your immune system, which during this pandemic, everyone should be working on increasing their lung capacity. Everyone should be working on strengthening their immune system. I just sent out a few newsletters in the past month. The most recent one is my immune newsletter. If you go to acupuncture, elementsinharmony.acupuncture.com/immunity-newsletter, you'll see a couple of boxes. Go ahead and click on the Superwoman or the woman who's wearing a cape, and you will see the newsletter. That is extremely important for everyone to see, so you can see the benefits of acupuncture and Chinese herbs, specifically for improving lung capacity and increasing your immune system, boosting your immune system. And I discussed quite a few things. I'll discuss that later. I really want to talk about the Qigong. Also, I did some newsletters on anxiety. If you go to elementsinharmony.acupuncture.com/anxiety-newsletter, you'll see a couple of boxes. Click on one of those boxes, and then you will see that newsletter. These days, everyone coming in has some kind of issue regarding wanting to make sure that their immune system's very strong, and making sure that any anxiety, any stress is at bay. So in regards to this Qigong video, I am doing Qigong again at 9 in the morning, and I will be 10-20 feet apart from anyone who will be around me. It's kind of cold right now, what we define as cold in Southern California, and so I'll be dressed warmly. I did a search on Qigong, Qi, second word Gong, and benefits, and also Qigong and lung capacity on PubMed. And you can, I have the sightings, so if you want to see what I did research on, you're welcome to fact check, and I'll also give the last name of the first author for each study. So when I did benefits of Qigong and benefits research on PubMed, I found 197 results. I'm not going to go through all 197. I'm just going to go through 5 studies that I've seen that I think you would be very, very interested in. The first one was Qigong and benefits. I found 197 results. And then the second was Qigong and lung capacity, 22 results. Now, there are other government websites that you can find scientific research on. These are the ones. I just stuck with PubMed. Otherwise this would be a very, very long video. I'm doing this video because I really want everyone to understand why I'm doing Qigong, and why when we had our first lockdown, today is December 12th, when we had our first lockdown, I did, I believe, 11 or so videos. I'm not a Qigong master. I know just enough to show a few moves, but enough for everyone, for myself, my family, and anyone that I show Qigong moves to, enough for us to improve our lung capacity. That is the whole goal with any of this. I've said in other videos, I've talked about I did a 74-minute presentation, and I did a 74-minute presentation on YouTube, specifically on COVID and Qigong, COVID and weight, the impact on obese patients, overweight patients, and I discussed Qigong there. So I want everyone to really understand why Qigong is so important. You can go on YouTube and you could just do it there, but I can tell you, when you do Qigong on the beach, it's so powerful and it's so different. So I'm just going to read through a few things. I'm going to try to keep this as short and sweet as possible. The first thing that I found that I thought would be interesting to you is depression, and it's called Depression and Anxiety Disorders, benefits of exercise, yoga, and meditation. So they kind of threw it all together, including Qigong. That was one of the first things that pulled up. When you're doing Qigong, you're cultivating your energy, and it is a form of exercise. So this was published May 2019, and the first last name of the three researchers are, the first last name is Saeed, Saeed, first initial S. So I'm just going to read to you what the conclusion was in the abstract. Supports adjunctive use. There are no apparent negative effects of mindfulness-based interventions. Qigong is considered a mindfulness type of internal work. And their general health benefits justify their use as adjunctive therapy for patients with depression and anxiety disorders. So basically, what does this say in that little abstract is that when the benefits of exercise, yoga, and meditation, and when we're doing Qigong, you are doing an internal form of exercise, and it's mindfulness. I'll be presenting I'll be doing a YouTube presentation later on in the month. I did a 10-page paper on mindfulness, meditation, and its health benefits. And I'm very proud of that paper because I found so much scientific data on how mindfulness meditation is very helpful in all sorts of mental health disorders. And so this first study basically says, when it says an adjunctive therapy, that means Qigong, among other types of meditation, other types of exercise, including yoga, is very helpful as adjunctive. That means you can use it along with other types of therapy in regards for patient related to patients with depression and anxiety. So that's a great thing to find there on PubMed. The second one is, should acupuncture, biofeedback, massage, Qigong, relaxation therapy, device guiding breathing, yoga, and Tai Chi be used to reduce blood pressure? Recommendations based on high quality systematic reviews. And in all of these, I have the DOI in case you're interested in. NIU is the last name of the first researcher that's on here, first initial J. Basically, this review ultimately included 13 systematic reviews and 14 non-drug therapies, which included a bunch of things, including Qigong, including acupuncture, wet cupping, Baduajin, bloodletting, auricular acupuncture, music, massage, moxibustion, relaxation therapies, biofeedback, device-guided breathing, yoga, and Tai Chi, based on inclusion criteria. So when it's a systematic review, that means this is one of the highest forms of reviews of scientific data that you can find. The quality of evidence was generally low, so that means that they tried their best to find data that they can rely on, but the quality of the evidence wasn't as high as they would have expected. And weak recommendations were given for most therapies, except massage and acupuncture, plus antihypertensive drug. Before I move on, what I want to share from this is that there aren't enough studies, and in my opinion, they kind of threw everything all in these systematic reviews. There are a lot of reviews out there, there are a lot of studies out there, but sometimes there's not enough studies on a specific thing. So Qigong happened to be thrown in all these reviews, and what they found was acupuncture, which I am a licensed acupuncturist, was something that they found to be helpful. Based on analyzed evidence, massage and acupuncture plus antihypertensive drug could benefit people who want to lower their blood pressure and do not have contraindications for massage and acupuncture plus antihypertensive drug. Why did I throw this one in? Number one, I threw this one in because there are people with stress who have hypertension. And I don't believe that there is enough scientific evidence to show Qigong beneficial for hypertension, for high blood pressure. However, it was nice to know that acupuncture was found. I've been a licensed acupuncturist since 1999, and I received my license in practicing massage in 1996. So it was great to see that there are enough evidence scientifically to show these forms of medical modalities or healing modalities, therapeutic modalities, to assist in reducing blood pressure. However, my opinion is that there's not enough scientific evidence. There haven't been enough studies yet in regards to qigong and blood pressure. I would say anyone that I train with, if you happen to have hypertension, or if you want, check your blood pressure before you do qigong, take your blood pressure after, and do that every day for 30, 60, 90 days, and see if qigong helps with your blood pressure. So the next 3 that I'd like to share, now it's already 11 minutes, so thank you for hanging in there with me, but I just want to make sure I do this video so some of you can see I did the heavy lifting. And this isn't really heavy lifting. This is just doing some basic research on PubMed. The impact of Tai Chi and Qigong mind-body exercise on motor and non-motor function and quality of life in Parkinson's disease. A systematic review and meta-analysis. Now keep in mind, when I did the first study, or when I did the first search for Qigong and benefits, I just wanted to see so far on PubMed what would be the top things that they would find. This one was published, I'd have to, this probably in, within, everything was done in the last 5 years. The last one was done, I didn't put it down here, but everything was done within the last 5 years. So Song is the last name of the first researcher on here, first initial R. So again, the impact of Tai Chi and Qigong mind-body exercises on motor and non-motor function and quality of life in Parkinson's disease. A systematic review and meta-analysis. So the conclusion is, evidence to date supports a potential benefit of Tai Chi, Qigong for improving motor function, depression, and quality of life for individuals with Parkinson's disease, and validates the need for additional large-scale trials. I thought this was such a great thing to find, considering that it's a systematic review. It means it's a high-level quality of study and a meta-analysis. So they basically said that Tai Chi and Qigong, that their evidence and their conclusion, evidence to date supports a potential benefit of Tai Chi and Qigong for improving motor function, depression, and quality of life for individuals with Parkinson's disease, and validates the need for additional large-scale trials. Motor function, depression, and quality of life. And that was a great thing to find. I was really, really happy to find that. This was actually done 2017, and the other one was, again, within the last 5 years. This was 2017. That was great to find. So the fourth one is efficacy of yoga, Tai Chi, and Qigong on the main symptoms of chronic obstructive pulmonary disease. A systematic review. Reychler, R-E-Y-C-H-L-E-R, is the last name of the first researcher, first initial G. This was done 2019, I believe. Results. So we're trying to find out the efficacy of yoga, Tai Chi, and Qigong on the main symptoms of chronic obstructive pulmonary disease, COPD. So we are now discussing lungs. 18 studies were included. 6 studies evaluated the effects of yoga, and the others focused on Tai Chi or Qigong separately or combined. So you can see how these studies don't just focus on Qigong. They also include Tai Chi and yoga and other type of mindfulness therapeutic modalities. The duration of the programs ranged from 6 weeks to 6 months, and the frequency from 2 to 7 times a week. Each session reached 30 to 90 minutes. Benefits were observed on lung function and functional exercise capacity, but benefit was clearly stated neither on quality of life nor on dyspnea, pain with breathing. Conclusion: this systematic review, which means it's a high quality study, highlights the potential of these therapies, Tai Chi, Qigong, Yoga, as complementary therapeutic approach in COPD patients. So basically, people with difficulty breathing, COPD, let's just look up the exact definition of what COPD is. For those of you who don't know, COPD, chronic obstructive pulmonary disease. So it's characterized by long-term breathing problems and poor airflow. That's from Wikipedia. Let's see what COPD definition. Let's see, pulls up symptoms. So let's go to a credible website, Mayo Clinic. So let's go straight to the Mayo Clinic. COPD. COPD, chronic obstructive pulmonary disease, is a chronic inflammatory lung disease that causes obstructive airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, also known as sputum, production, and wheezing. It's typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer, and a variety of other conditions. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. So these are all lung issues. These two conditions usually occur together and can vary in severity among individuals with COPD. Chronic bronchitis is inflammation of the lining of the bronchial tubes. It's characterized daily by cough and mucus production. Emphysema is a condition in which the alveoli at the end of the smallest air passages of the lungs are destroyed as a result of damaging exposure to cigarette smoke and other irritating gases and particulate matter. Although COPD is a progressive disease that gets worse over time, COPD is treatable. With proper management, most people with COPD can achieve good symptom control and quality of life, as well as reduce risk of other associated conditions. So I wanted to go through that so you understand which, in this fourth study that I'm presenting, efficacy of yoga, tai chi, and qigong has been found to benefits were observed on lung function and functional exercise capacity. The systematic review highlights the potential of these therapies as complementary therapeutic approach in COPD patients. So it's a positive result. Positive results in these COPD patients. And then the number 5, thank you for hanging out. I just appreciate you being here. I really would like for you to understand the benefits of Qigong. So the first one was on depression, anxiety. The second one was on blood pressure. The third one, and we determined that there have not been enough studies yet, but they found acupuncture and massage to be helpful. The third one on Parkinson's disease. The fourth one on COPD, and now the fifth one is effects of the Tai Chi Qigong program on functional capacity and lung function in chronic obstructive pulmonary disease, a randomized control trial. So the fourth one was on systematic review. This one's an RCT, a randomized control trial. So the last name of the first researcher is Kan Tatong. The first letter is T. The first letter of their first name is T. And this was done 2019. The primary outcomes of this randomized control trial were functional capacity, 6-minute walk test, and lung function. The secondary outcomes were dyspnea score and quality of life. So I believe dyspnea, it means exactly pain while breathing, but let's just make sure. dyspnea. Shortness of breath. It means shortness of breath, not feeling not being able to breathe well enough. So I apologize. It means, and it's a subjective experience of breathing discomfort that consists of qualitatively distinct sensations that vary in intensity. So yes, there is pain while breathing, and the person's unable to breathe, take full breaths. So the secondary outcomes were dyspnea score and quality of life. The Tai Chi Qigong group demonstrated significant improvement in functional capacity at week 12 and 24 with a p-value of under 0.05. And for those of you who are researchers and want to know the validity of this study, dyspnea score and quality of life at week 6, 12, and 24, p-value also under 0.05 when compared to baseline. Functional capacity, forced expiratory volume, and first, second, dyspnea score and quality of life were significantly better in TCQ group, Tai Chi Qigong group, from week 6 to week 24 when compared to the control group. Combined center and home-based Tai Chi Qigong training for patients with mildly and moderately severe COPD is effective in improving functional capacity, dyspnea score, and quality of life. So let's break that down. They found that compared to the control group, a control group was the people who did not do any Tai Chi or Qigong. And the people who did Tai Chi and Qigong, they found a significant improvement in functional capacity. They also scored higher in quality of life and dyspnea. Remember we were talking about the pain, not breathing, not being able to take full breaths. So that's really important to understand. So improving functional capacity in regards to the lungs, dyspnea score, and quality of life. Everything was about lung function, and I really wanted to end on that. This is, so again, there were 197 results for Qigong and benefits, and 22 results in regards to Qigong and lung capacity when I looked up on PubMed. So this is why I've been doing Qigong once or twice a month at the beach. You can do it at home, but it's a lot different when you're at the beach. I have a patient who is in a healthcare provider, and she works in a hospital, and she is dealing with severe mental health issues right now, and there is alcohol involved, and she's doing her best to control her health issues so she can make sure that she's on top of things. And so far, it's been a battle. She's doing her best at work, and she's doing everything she can to keep it all together. Does this sound familiar? This is a very difficult time for people right now. And I really wanted to share this because acupuncture is very good and very effective at treating depression and anxiety. Qigong is super effective at treating anxiety and depression. So far, with the second one in regards to hypertension, they don't have enough evidence yet that Qigong can help with lowering blood pressure. However, they found acupuncture and massage to be beneficial in reducing hypertension. And I can tell you, since I've been in practice since 1999, acupuncture is extremely effective in reducing hypertension. I have a lot of evidence of that. The impact of Tai Chi and Qigong in regards to Parkinson's disease, non-motor function and motor function, and we found positive results there. And also in regards to chronic COPD, with a systematic review, and again COPD in regards to a randomized control trial. Acupuncture is very beneficial for all of those. That's what I found in the last 21 years. Qigong, I can tell you, is very beneficial. Very, very beneficial. And just because I haven't, those are a lot of results, 197 and 22. So, and there are a lot more research. But I just would like everyone to understand just how powerful Qigong is for your lungs, for people with motor skills issues such as Parkinson's, how helpful it is in regards to depression and anxiety. Acupuncture is one healing modality, one medical modality. Qigong is a mindfulness type of exercise, and it's so powerful. And Chinese herbs, I'm taking several things on my desk, and I keep talking about Immune Plus. There are other things also, but this is something that I'm taking almost every day because I'm alternating with other types of herbs. So I got the acupuncture going on, I got the herbs going on, and I got the qigong going on. And meditating. These days, people have been seeing me. Every time I have a break, I'm just sitting there and meditating. I had a phone consultation with a student, an acupuncturist, a student yesterday, and she's a doctor of Chinese medicine. And we were talking about how we handle her stress and how she handles her relationships with her patients when they're dealing with anxiety and just vomiting emotions at her, and how is she handling things. When I say vomiting emotions, like when she doesn't allow herself to stay centered and she starts crying with them. You gotta be centered. People, you gotta be centered. You have to be in a place where you can handle listening to people. And if you can't handle listening to people without allowing their health issues to affect you, then we really need to work on taking care of you. You need to put the mask on you first. I told her yesterday, I think I had 21 plus patients, and I said, do I sound tired? I had 2 consultations last night. The first one was at 7:20, 2 phone consultations, and then the next one was at 8 p.m. And she said, you don't sound tired at all. It's because I do these things. I have a family, and there is work. There's work everywhere, and there is going to be anxiety and stress everywhere if you allow it to. So I'm going to be doing qigong tomorrow at the beach at 9 a.m. And this is part of what I do for self-care. I'm going to be at the ocean. Everyone's going to be 10 to 20 feet apart from me. If people join me, great. If they don't join me, that's fine, because I'm still going to do it. Qigong is so powerful. And especially these days where people just aren't getting the hugs they need, it is so important to at least have human contact. So before I let you go, I do want to revisit this woman who works in the healthcare system, and she's dealing with a lot of stress. And she said she misses hugs. And she had touched my hand, and that was like so powerful for her. It's powerful for me. And when people aren't getting their hugs, when people aren't getting the physical contact, how do you think that's affecting them mentally? And they're getting notifications on their phone all day about this pandemic that's going on. You have to practice being around people, even if it's 10, 20 feet apart, just to say hi, just so you can feel human. There are so many people suffering. I just did a video a week ago or so on anxiety. There are things you can do to still have human contact. You can still smile at people, even if they can't see your face. If you're wearing a mask, they can, there's people that are so afraid to look at people in the eyes. I go places and people are just afraid to smile because they're living in so much fear. You don't have to live in fear. You can be in control of your life. And Qigong is one way that I take control over my life. I need to be there for my kids. I need to be there for my husband. So how do I do that? I got to be there for myself first. And so let's all be kind to each other. And one thing that I've done is I turned off my notifications on my phone. I don't need to be notified of each and every thing out there, especially in regards to anything that's going to tell me everything about COVID. If I want to know, I'll look it up. It's not hard to find. And I understand this is a serious virus, and I never closed. What I did was I kept doing more acupuncture, taking a lot of herbs, doing qigong a lot more intensely than I used to, doing my meditation, and being as calm as possible. This is how you stay healthy. The body follows the mind follows the spirit. If you're in a chronic state of fight or flight and stress out and anxiety and depression, and I'm talking to everyone, including other doctors, acupuncturists, and people in Western medicine and other types of healing arts, I heal, I work on all kinds of people, and they're dealing with stress, and that is going to lower your immune system. Just go online. Does stress affect the immune system? And I think you'll find that yes, it does. And I'll do another video on that. So thank you for watching this pretty long video. I hope you understand the benefits of Qigong, the benefits of acupuncture. We didn't really talk about acupuncture, but I really want everyone to understand that Qigong is very powerful. It will increase your lung capacity and you will feel calmer. All right. The name of my website is elementsinharmonyacupuncture.com. My office landline is 949-305-1703. You can text me at 619-341-4341. I hope you have a very, very good holiday season. Please do your best to do your Qigong. Go to your local acupuncturist or come see me. I'm in Laguna Hills, 5 minutes off the Lake Forest exit. Again, my website is elementsinharmonyacupuncture.com. And do whatever it takes to stay calm. That will keep you super healthy. All right, take care.